What are some important reports that should be run? What kind of things should I be looking out for to make sure everything is done correctly for the financials of my dental practice? What key indicators do I need to be checking on a daily, weekly, monthly basis? How do I read and understand these reports to help me take the right action towards management of my dental practice? I'm going to share with you what I do in my own practice to make sure I, as the owner, know and understand ins and outs of the financials of my dental practice. In the everyday busyness of the office, as clinicians, we're completely focused on seeing patients, making sure you're starting and finishing treatment on each patient on time as much as possible, and you're doing quality work that you're happy with. However, by the time you're done with your last patient, you realize you've only done one part of the job as the business owner. You've done your part as a clinician, but now you've got to put on your hat as the business owner and actually sit down and make sure whatever work you just did on patients, you got paid for. Or if you take insurance, that you will get paid for. And most importantly, the money actually ends up in the bank account. Hundreds of practices every year are victims of embezzlement. And if you and your team don't have the right systems in place for checks and balances, things will slip through the cracks. And what I mean by that is money will slip through the crack. And you'll be left wondering, when you've been so busy in the past few months seeing patients, you're just not seeing the money that you expected. When I was starting my practice, I just didn't know where to look. There are many reports that you can pull from your practice management system. I just didn't know which ones to look at or what I was looking at. And if you don't understand what the numbers mean, you're not going to know which direction to go in or what action to take so you do get the results you want. But over time, I learned through some very costly mistakes, not just in terms of money, but also my time. I learned these reports inside out so that on a daily basis, now I know how much production I do in net from working on patients, how much I'm going to get paid from insurance after write-offs, how much is getting billed to the insurance, the correct adjustments are made, whether it's in the form of discounts or any unpaid balances that I don't care to go after. What's coming in from insurance companies, from patients, from third-party financing companies, and most importantly, how much money actually ends up in the bank account from what we're collecting. All right, let's get started. I do want to start off by mentioning one thing. When I'm discussing reports in this video and what you should be looking at, these reports are specifically from Open Dental because that's what I use in my own practice, but it does not matter what system you use, okay? You could be using Dentrix, EagleSoft, whatever it is, the concepts I cover in this video still apply and are universal throughout any systems you may be using. You should be able to pull up similar reports from your system, so it's more important that you grasp the ideas and concepts. To start off, I'm also going to assume certain things are already in place. Your insurance fee schedules are set up and entered into your practice management system. And if you happen to use Open Dental, that your PPO plans are set up to be of type PPO percentage. Second thing I'm going to assume that's already in place is you're doing insurance verification for every insurance patient and correct information is attached to their chart. This is so your practice management system can tell you and your team correct copays and also have correct expected claim amounts attached to the outstanding claims. All right, let's move forward with the first question. What are some important reports that I need to run and what are some important things I should look out for to make sure things are done properly for financial reconciliation? Most practice management systems come with a whole bunch of reports, but it can be very overwhelming because you don't know which ones to look at. The first thing to do is understand what it is you're trying to achieve. What information are you looking for to help you make a decision? Once you've answered that question, you can usually narrow it down to a few reports that give you that information. To start with, I'm going to focus on things that are readily available within Open Dental and all the other systems out there. But there are a few things that I like to track on a daily basis that I feel are super critical, but they just are not readily available in most of the systems, including Open Dental. So make sure you stick around to the end and I'll actually show you these things that I like to track to make sure things don't slip through cracks. Before considering weekly and monthly reports, I like to start with the most important day, which is today. What do I care about today? So number one, for each appointment, does Open Dental treatment plan reflect correct patient out-of-pocket that is due for that appointment? Remember, as I said earlier, this is why the setup is going to be important, where your correct fee schedules are entered into the practice management system, as well as correct insurance information is attached to the patient chart. This is important because the pending insurance payment plus the expected patient out-of-pocket is going to equal the in-network or the allowable fee for that procedure. And if you total that up for each procedure that you plan to do in that appointment, it should give you the net production of that appointment. Number 2, at the end of the day, I want to know how much I produced in net, meaning what was my adjusted net production. Number 3, how much did we collect? The money can be from patients directly, or insurance checks that may have been entered, or third-party financing companies like Care Credit, or in form of EFTs from insurances. Number 4, were there any adjustments, whether it's courtesy discounts or like in-office membership plan discounts, or any write-offs of unpaid balances that we don't care to go after. Number 5, for all appointments, are correct procedures attached to that appointment prior to marking the appointment complete and then generating the claim. Number 6, are pre-authorizations generated for all the patients that we need to send them out for? And finally, number 7, what does the schedule look like for the next 2 weeks? So let's now look at each one of those. Number 1, it's important to know how much net production is attached to that appointment. When this appointment was made, correct procedures should have been selected from the treatment plan and then attached to this appointment. The patient for this appointment may have insurance, they may have your in-office membership plan, or they may just be a fee-for-service patient. Whatever it is, when you click on the appointment and you go to their treatment plan, your team should be able to identify what the patient out-of-pocket is going to be, and if the patient has insurance, what the expected insurance reimbursement is going to be for that appointment. So let me explain what I mean. Let's look at a sample appointment. So let's say this is today's schedule. This is the patient coming in next, and I'm looking at this patient's appointment on, this happens to be open dental. So if I'm looking at the appointment, I can see that number 3, post-core and crown, is a procedure attached to the appointment. I can also see that there's net production attached to that appointment, and this happens to be $1,097, so $1,097. And this patient happens to have MetLife insurance. So now if I click on the appointment, go to their treatment plan, this is what I mean that you should know ahead of time, or your team should know ahead of time, what the patient out-of-pocket is going to be, as well as what the insurance estimate is going to be. So when I'm looking at the treatment plan, I already know that all the treatment on their treatment plan is already sequenced, right? So you can see on the left side, priority 1, 2, and 3. So priority 1 would be the next upcoming appointment, which happens to be today. And attached to that appointment is procedure post-core and crown on tooth number 3 and the crown on number 3. What you're also going to see is the column for insurance estimate and the column for patient portion. All right. So when I'm looking at this, whoever in the office, whether it's my assistant, the front desk, or any provider in the office, they can look at this and say, okay, yes, we expect $536 from the insurance, but the patient portion, what they're going to owe today when they check out is $560.70. All right. And the sum of the patient portion as well as the insurance estimate equals the net production, which is $1,097, which I explained earlier. And that is your total allowable fee for those 2 procedures. All right, so this is a very important concept you guys understand. Okay, let's move on to the second one, figuring out net production. Maybe it's the end of day, or maybe it's the middle of day, and you would like to know how much you've produced so far in net. So how do you do that? Well, in Open Dental, you can pull up their daily production and income report. And this report is going to show you the patients seen, adjustments, estimated write-offs, and the collections. So let's show you how we pull up the daily production report. You would just go to reports, and this window would pop up, and you would go ahead and click on more options. And it's the daily, because you are looking for production for today, so that option is already selected. If not, just hit today, and that should select today's date. And you want to make sure this option is selected using procedure date. You don't want to do using insurance payment date because you are seeing these patients today. Obviously, you haven't generated the claims yet, nor the payment has been made. So just make sure this second option is selected using procedure date. All right. So then you would click OK. I'm not going to generate this report. I already have a report pulled up, which I'm going to point to. So here's the report that I want to go over with you guys. Let's say I pulled up the report for today's daily production, middle of the day, or whether it's end of day. You're going to see a couple of things on here. Obviously, today's date. You're going to see the patients that you're going to see or going to see, or you may have already seen. You're going to see the description of procedures that you completed. Of course, your production, that column refers to your office fee. You're going to see adjustments. You're also going to see write-offs. Okay, write-offs meaning the estimated insurance write-off because these procedures have not been paid yet. So let me point you to this little box here. I want to show you an example of a specific patient. So we've done, let's say, two two quadrants of scaling root planing. So in the production, you see here's the one row is for one of the quadrants, and the other 232 amount is for the other quadrant. The 232 is the office fee per quadrant scaling root planing. So the write-off is shown as 0 there. The way Open Dental does the estimated write-off, it actually shows you a separate row. So you can see it here. This patient happens to have Delta Dental of New Jersey. So you see the row for SRP, Delta Dental of New Jersey, and then not showing under production, but instead of write-off. So minus 92 is the write-off, which means 232 minus 92 would be the allowable fee, as I've written here in this box. So the production column minus the write-off would be the net adjusted fee for that procedure, in this case D4341, which would be scaling and root planing. All right, just exactly same example at the bottom. This patient came in for a recall exam, x-rays and cleaning, and you would see all the procedures basically listed twice, right? One is the actual procedure, like for example, bite wings 4 radiographic image for this patient here, for example, and then you would see the same thing for BW Delta in New Jersey. That's the write-off. So my in-office fee is $70, and the write-off, the insurance estimated write-off is minus 29, and 70 minus 29 would be the net adjusted fee for that procedure for the bite wings. All right. On the same report, at the bottom, you're going to see these two numbers all the way at the right. One is the patient income on the left, and all the way on the right, the 1976 days insurance income, which means any EFTs you received or insurance checks, they may have been entered. All right. And all the way at the bottom, you're going to see the total collection. Now, because this report also shows you collection, you're going to see a list of patients that you may not have seen on this day, but for whom your team may have entered checks for, meaning claim payment came in, so they entered it into Open Dental, and now you're going to see that collection as well. So the production is shown as production plus any adjustments minus write-offs, as I had shown you guys just in this box here. That would be your net production. And the income, which would be collection, it's a combination of whatever patient income came in and as well as insurance income. On to the third one. How much did we collect? And any given day, whatever money you collect can be in the form of patient cash, insurance checks, patient checks, insurance EFTs, or third-party financing like care credit receipts. To just find out how much you collected in form of patient payments and insurance payments, regardless of the type of payment, then you can just pull this up on the same report we just discussed earlier. Again, this is the same Open Dental production and income report. Towards the bottom, you see the two numbers. One is insurance income and the other one is patient income. And all the way at the bottom, you'll see the total income. To break down the collections in different forms of payments, you can actually pull up the built-in payment report, which is under the list of daily reports. As you can see on this image, you're seeing a list of insurance payments, as well as one EFT payment and patient credit card payments. What I do in my practice at the end of day, which takes me less than 5 minutes, is we sit down and we pull up this report and then match up all the payments that you see on this image, like insurance checks, EFTs, credit card receipts, and the totals report from the credit card terminal to every single payment that you see on the payment report. While you're looking at the insurance checks that have been entered into the practice management system, you would also want to know whether the payments that were entered were actually lower than what you expected. If you're looking at a specific pending claim on your practice management system, it should show the expected insurance payment. And if your team goes in and enters payment that is lower than that number, basically it's lower than what you expect, you need to know what the next plan is for the remaining balance. Are you writing off this balance, or are you going to try to build a patient and try to collect? In my practice, if there's ever going to be a patient balance when a claim payment is entered because it's lower than what we expect, we immediately set up a patient balance follow-up on Teamio. This is basically a reminder from my front desk person who is responsible for collecting that balance to call the patient on the day they're supposed to start following up. This way, you've already set up accountability for things that need to be completed on a particular day. This is better, in my opinion, than relying on Open Dental's aging report and looking through the list of patients to be called. Okay, number 4, were there any adjustments? Adjustments can be in the form of courtesy discounts, membership plan discounts, depending on how they're set up, broken appointment adjustments, if they're set up, or a manual write-off of a balance that you decide to not collect. At the end of the day, you need to know what adjustments were entered into the practice management system. And specifically for Open Dental, you can pull up the adjustments report from the list of daily reports. All right, moving on. Number 5, Are correct procedures attached to the appointment before marking the appointment completed and then generating a claim if the patient has insurance? This is super important. The provider, whether it's a doctor or a hygienist, associate, whoever it may be, they need to make sure correct procedures or whatever work they did on the patient are attached to that appointment. Some offices don't really do this. They simply just work on the patients or tell the front by a paper route slip or just tell them verbally of what procedures were completed. I find it easier when the provider who's in the operatory simply selects a procedure from the patient's treatment plan and make sure they're attached to that appointment. This way, when the patient walks to the front to check out, now the front desk is going to mark the correct procedures and of course the correct number of procedures completed. And also if the patient has insurance, will generate a claim. Number 6, are the pre-authorizations generated and ready to be sent out for patients we need them for? If you saw patients today and you've treatment planned work that needs to be pre-authorized, you need to generate a pre-authorization claim with those procedures attached. You also need to make sure you've given your team the supporting documentation to avoid delaying processing of these claims. Things like perio charting, x-rays, intraoral photographs, etc. Number 7, what does the schedule look like for the next 2 weeks? Or do we have holes in the schedule? Are we scheduled to production goals? Instead of worrying about the schedule for the next 4 weeks, I like to focus on just the next 2 weeks. We all know that patients do cancel last minute. Anything beyond 2 weeks, I find there's more chance of holes in the schedule because patients change in the schedule either at home or work. You can pull up the schedule production report from your practice management system and see what you're scheduled to for each day you're in the office for next 2 weeks. So under reports, on the top section here under production and income, you're going to see this option of monthly production goal. Let's go ahead and click on that. And it would bring up this little pop-up. I'm going to keep this option selected where you select all the providers. And what I'm looking for is the next 2 weeks, for example. Let's just, okay. So you could just have, if you just wanted to see the scheduled production, let's say you're walking into the office and you wanted to see the scheduled production just for that day, you would just put in 5959 that day. At the bottom, you want to select this option. Again, remember, I'm only in the office 2 days a week, so that's why you see less days and you see a bunch of zeros for the different days that I'm not in the office. You're going to see scheduled. This is your gross production. This is like your UCR fees. The adjustment column shows you there are some adjustments already in the future because I have some in-house membership plan patients who are coming in and those adjustments have already been entered. So it's taking that into the account from the treatment plan. The write-offs are not actually indicated here. They're all zeros. But actually what you're seeing in total production, this number is not net production. This number is only taking into account adjustments. It's actually not taking into account any write-offs, all right? So bear with me for a second and I'll show you how to turn that setting on where you wanna see the write-offs in the future. So you have an idea, hey, this is my net production that I'm scheduled to. I don't care to see the gross production. So for example, if I charge $1,000 for a crown, well, it doesn't matter because if I'm seeing a MetLife patient and their fee is $800, my net production when I see that patient for a crown is $800, not $1,000. So I want to see the write-off taken into account and then showing me the net production, right? And this is not it. So let's close this out for a second. You'd have to close this out and you have to make sure a certain setting is on. So you would have to go to your setup. You would go to reports and on the right side, you see this last tab called miscellaneous settings. You have to select this option, monthly production and income scheduled production subtracts PPO write-offs. You want to make sure that's enabled. Okay, and then you would go ahead and click OK. All right, now if I were to go back and regenerate that report, let's do the same thing. I'm going to again select the same dates, May 9th through the 29th. Leave the same option using procedure date. Let's click OK and let's see what comes back. Let's zoom in and now you see that number is way better. Okay, that number is the net production. It was something like 64K or something like that, but this is the true net production. Again, adjustments are taken into account, One of the problems, or I would say one of the weaknesses with Open Dental, this specific report, even though estimated write-offs are taken into account, they're still being displayed as zero. But I know they're being taken into account because you can do it manually. I've actually done the manual number, and it is 5689 on May 13th, or 3751 on May 9th. In my practice, when I had a hygienist, I'd pull up this schedule production report, but unfortunately, I can't see the breakdown by provider. In order to see each individual provider's schedule production, I'd have to select individual provider, then generate the report again. I can always select multiple providers and see the totals, but I can't see the individual provider production broken down by the day. And to do this for each day you're in the office for the next 2 weeks was super time consuming. And for that reason, I now utilize Teamio's next 2 week schedule production to give me a quick glance at what's going on my schedule for the next 2 weeks. So those are the 7 things that are important for the reporting aspect on a daily basis. What about weekly reports? Well, once a week, you need to be running an outstanding claims report for claims that are past 30 days old. What this means is that you want to have your team look into claims where you haven't been paid because it's been 30 days since the claim was sent. This report you can pull up from Open Dental is listed under the monthly reports. Even though it's listed under the monthly report, you want to do this on a weekly basis to stay on top of insurance AR. Under reports, you would go to this bottom section called monthly, and underneath that, there is a section called outstanding insurance claims, right? You click that. All right, the first thing I like to do is I don't want to see any pre-authorizations that have been set. I just want to see claims. So not including, so I'm going to say excluding pre-auths, okay? So over 30 days, I only have 3 claims that are pending. Let's just make this 20 just to get more information on here. Okay, so now you see more claims that are pending past 20 days. These are insurance claims that haven't been paid yet. So it gives you the insurance name, all right, the patient information, as well as date of service and when the claim was sent. All the way on the right side, you're going to see the gross production or the gross fee attached to that claim. Again, this is not the net fee. This is not what you're going to get paid. So now let's say if I were to click on this patient here to bring up the claim details, these are the procedures that are attached to that claim. And what I estimate from the insurance is actually $362.50. Okay, that's what we're estimating from this insurance to get paid on this claim. Not $2506, but $362.50. All right, and that is the $1401 is the write-off. All right, we've already collected what we didn't get from the insurance from the core build-up directly from the patient already at the time they came in for the prep. All right, so I'm going to close this out. So that's how you would view the details on each claim. Another weekly report is the aging of accounts receivable report. This specific report, for instance, is used to track patient balances, taking into consideration insurance estimates as well as write-off estimates. What this means is that this report is going to show you patient balances after taking into consideration insurance estimates, even if the claim has not been received yet. It's also going to show you any patient balances if all the claims have been marked received for that patient. The patient balance may be there because the insurance ended up not covering a procedure you thought was going to get covered. Maybe the insurance underpaid for a procedure, meaning they paid lower than what you thought was going to get covered. And if the patient just simply didn't pay their part of the copay on top of the insurance. The aging of AR report. Okay, again, you would go to the report section, and the way you pull this report up is it's listed under the monthly. So you click on this, and this pops up. I like to leave everything as is. Now I want to include any balance, okay, as of today's date, group by family, and everything else can stay the same. All right, and then you would just hit OK. All right, and it would take a little bit of time to generate the report. Now, instead of looking at this report here, I'm going to show you a different report. Let me switch over to here. So if you're looking at the report on this side here, let me show you what you're saying. The guarantor is the person financially responsible for each account, and you're grouping it by family. So if it's a father who's responsible for the financials of the whole family, the father and the 2 kids and the wife, all of them are on the one account. You're going to see the father's name here. So it's listed by the guarantor's account. Then you're going to see 0 to 30, 31 to 60, 61 to 90, and for 90 days, meaning this is the time range the patients owe money. All right. You're also going to see the actual total, which is just a gross fee. And then you're going to see, if of course, if the patient has insurance, a write-off estimate, insurance estimate, and actual patient balance. So let's look at the ones highlighted in red. For example, in this case here, you can see this first red box here. You can see there's over 90 days balance of $184.40. Okay. And when I look at this balance, what I try to do when I look at this report, I try to look at this column on the right, which is the patient balance. Then I look at if there's a balance, then I go over to the left, and then I see how long the balance has been on the account. The next step, the next decision we want to make is, okay, are we collecting this or what's going on? This patient is in between implant work, and that's why they have this balance, which will finish up collecting when the patient comes in for implant crown. The $50 here, for example, well, this balance should be collected because it's over 90 days old, and this is due to our adjustments to the account because we wanted to collect or charge the patient a fee for canceling last minute. And that was our fee, which we have not collected yet. It's been already over 90 days. That's why it shows $50 balance. Actually, what you're saying is, well, this patient is in the middle of work, like we've generated a claim. So here's the write-off estimate, 742, the insurance estimate, which means the claim that has been generated, and 381.70 is what we're expecting back from the insurance. And we have already collected the patient out of pocket at the time of their initial visit when we started work, which left the patient out of pocket, whatever, after the patient out of pocket to zero, meaning that's why the balance is zero, because the patient owes nothing. All right. And that's why you're seeing it like this. Okay. So that's the most important thing you want to get out of this report. All right. And like I said, most important key of this is you want to make sure this report is as short as possible. Even though this report is listed under monthly reports, you want to look at this on a weekly basis. Remember to keep this report as short as possible. You should be reviewing it weekly so you stay on top of patient balances. You should either track on an Excel sheet or add to the pop-ups or some sort of reminder system attached to each patient's chart for a practice management system for tracking patient balances or why they exist. In my practice, we now rely on Teamio's patient balance feature to track all this and to stay on top of who owes money and who's being followed up with. Okay, let's keep going. Another nice report that's built into Open Dental is the procedure not billed to insurance. We like to run this report at the end of the week to give us a list of patients who may have come in, gotten work done, but never had a claim generated to send out for a payment. Usually, this report returns not many people on the list since it's usually caught during our daily routine at the end of the day where we check whether or not a claim is generated for each appointment that's on the schedule. But in case something is missed, this report is going to help you catch the ones they may have slipped through. So that's it for the weekly reports. Let's now talk about the monthly reports. At the end of the last working day of the month, I run the net production and income report. You can also run this on the first of the next month for the previous month. The information I'm looking for is how much did we produce in net and how much did we collect for the month, meaning how much money actually came into the practice. Let's look at a sample report. Under reports, again, you're going to go into more options. And let's say this is the 1st of May today, for example, and I want to look at the previous month, meaning all of April's information, like how much I produced in net and how much we collected. I would just go over and select this monthly option here at the top left. And then instead of this, I'll just scroll to April. So April 1st to April 30th, I would leave this option still selected using procedure date. And then I would hit OK. And then here is the report. And instead of going over all the columns right here first, I'd scroll to the bottom and then you can see all the information there, which is the total income, the patient income plus the insurance income, which is, a combination of whatever the insurance checks came in, the EFTs, whatever it may be, and plus the patient income, like patient checks, cash, whatever it may be. That totals up to $52,000. And then it's broken down into patient income and insurance income as well. And you have your total production, which is your net production, which is defined as the gross production plus whatever scheduled, the adjustments like your discounts or in-house membership discounts, adjustments, as well as insurance write-offs, okay? And that total production, net production, was actually 51,342, and we collected more than that, okay? So for example, here, these columns are pretty self-explanatory per each day we're in the office. For example, again, I'm there 2 days a week, and here it is. Here's the gross production. Here's some adjustments that have been made on the schedule, most likely due to our membership discounts that we offer to our in-house membership patients. And here's the actual write-offs from insurance. Once a check or a claim gets entered, the write-offs get applied and they get displayed here, okay? Which brings that total production, for example, on April 1st from 7,300 back to 3,300. That would be the total net production, and gives you the patient income, what we did in collections on that day. 1856 was the patient collection, and insurance income was none that day. So total collection that day would be 1856. And you total all of that up, and that gives you the total income of 52,125. Okay, so that's how you would come to that report. For the monthly financial reports, this is really the only report I look at. Your daily routines take care of 90% of the work, and the weekly routines take care of the rest. And that's why I mentioned earlier that the most important day in your practice is today. Earlier in the video, I mentioned that there are things that are not readily available within most of the practice management systems, including Open Dental. But just because they're not available does not make them any less important. In fact, they're so important, sometimes I wonder why most of the practice management systems, including Open Dental, don't build these in. One of these is measuring and looking at my own case acceptance rate, meaning what am I diagnosing and treatment planning in terms of procedures and dollar amounts, and how much of that is actually getting scheduled or completed by patients. And the way I get this information now is through Teamio's Daily Huddle. Look at this information on Teamio called the Huddle. All right, so this is something I review every morning throughout the day, as well as the end of day. So I have different routines in place. So towards the end of day, since we're talking about case acceptance, what I want to see is, hey, how much did I diagnose? And whatever I diagnosed today in terms of procedures and dollar amounts, how much actually got either completed or scheduled? Okay, so what was accepted by the patients? So I've broken it down. For example, I'm the only provider in the office. If you had multiple providers, you would see that information here: provider 1, provider 2, hygienist 1, hygienist 2, etc. So for example, for myself, today, this is May 6th, 2 days ago when I was in the office. That day, you can see the information on top. Overall information, I diagnosed or presented to patients $3,200 worth of work, and that's exactly what got accepted because we ended up scheduling everything that we recommended that day. So you can see the breakdown by the patient name, the net fee, including write-offs, the actual procedure that was treatment planned, what to, the description, the provider, and of course the status of the appointment.